Dr. Rick Fijten. I'm one of the GP partners at the Albion. Thanks so much for joining this evening. We have, I think, about 4 or 5 people in attendance. We are expecting quite a few more, so we just thought we'd give it about 5 minutes before starting the talk. So if you don't mind just bearing with us, we'll give it a couple of minutes and then we will start. Thank you. Oh my what? Good evening, everybody. My name's Rick, the Albion. Thanks so much for joining this evening. We are expecting a few more people to attend this evening, so if you don't mind hanging on for a couple of minutes whilst we wait for those people to join, and then we will start the talk. Thank you. Okay, perfect. I think we're going to start because we're mindful of your time this evening. So, oh, I think we're going to give it another minute. Oh, perfect. We'll start now. Okay. So as I said previously, my name's Rick Fijten. I'm one of the GP partners at the Albion Surgery. I'm joined by my colleague Emma McDevitt, who's our communications lead, and I just want to say thanks so much to her for organising this evening's webinar. We're also joined by my colleague Miran Patel, who's one of my fellow GP partners, who will be answering questions that you might have in the Q&A, the chat. So if you do have any questions during the talk, please do pop them in the Q&A, and Miran will try his best to answer them. If not, we'll go through those at the end. And if we don't have time to go through all of those questions, what we will do is we will go through them after the webinar, and we'll put the answers onto our website for you to review. So we'll definitely get through them all. So thanks again for taking the time to join this evening. So this evening we thought would be a really good opportunity for you to learn more about the practice, provide feedback, and ask questions, and work together to try and improve the service that we deliver to you. Just a housekeeping rule. So this evening isn't a forum to discuss medical queries. So just wanted to give a brief introduction to the surgery. Some of you might know this information, but others might not. So I thought it provides some nice context to what we're doing every day. So we have roughly 15,500 patients in our practice, so very big practice, and we have got a very big and fantastic team made up of a number of GPs. We also have trainee GPs, and we have medical students who join the practice most weeks. We also have nursing students as well. And in addition, we have a paramedic who's able to see lots of different presentations, including cough, shortness of breath, sore throats. We have an advanced clinical practitioner who can manage conditions such as heart failure and asthma and diabetes. We have a very senior physiotherapist who's fantastic. He can do assess and review lots of different musculoskeletal presentations such as knee pain, hip pain. He can also offer injections, which can be very effective treatments for joint pain. We have 3 clinical pharmacists, pharmacy technician, 3 nurses, a healthcare assistant, and we have a really big non-clinical team as well, who are crucial in the work that we do. So we've got a really big team, which means that hopefully we can provide you with a really good service. So I just wanted to go through our core values as a practice, and hopefully these are the values that have sort of guided the changes that we are hoping to make in the next couple of months, and the changes that we're going to share with you this evening. So excellence, inclusivity, compassion, collaboration, integrity and innovation are at the heart of everything that we do at the Albion Surgery. So I just wanted to share some of our successes over the last, well, in January specifically. So in January we saw roughly about 3,500 patients face to face. We carried out about 3,000 telephone appointments, and we managed nearly 5,000 online queries related to lots of different things. We did a number of medication reviews, and also we did 60 or up to 60 cervical smears, which play a crucial role in screening for cancer early on. So these are really, really important, and just great successes that the practice has achieved over the last month. I think we have had our challenges. I think one of those has been missed appointments, so do not attend DNAs. So we have some of the highest rates of missed appointments in the local area. So the monthly average is roughly about 210. So that does have an impact on the appointments we can then offer to yourselves and other patients. So that's something that has been a challenge for us as a practice. We've had, and sure we will have over the next 12 months and beyond, unexpected staff sickness. So that always puts a strain on the system. So in terms of our priorities going forward, what we really want to do for yourselves and other patients is improving access to the practice, improving the quality of care that we deliver, and also improving continuity of care, which we feel is really, really important. So there's a few ways that we hope to achieve this over the next couple of months, and that's what we want to speak to you about today. So um, the first step will be moving towards our online system being so our way of contacting the practice. So currently it's through something called AccuRx, open from 8 till half 6. Of course, when that's not accessible currently, you are able to phone the practice, but sometimes there are delays in getting through to us on the phone. So hopefully by creating an accessible online system in that time, we will improve your access to the practice and your ability to contact us. So um, so step two ties in with step one. Um, and what we've decided to do from April is to switch to a new way of contacting us. So we will move away from AccuRx, as I've previously mentioned, to a system called ChatDoc, which is a platform which is WhatsApp based. This is a system that's been used in lots of other GP practices, and it has been used in lots of other ways to monitor patients during COVID, where patients couldn't get in to see their GP, so monitoring their oxygen levels at home, monitoring their asthma and other conditions. So we feel that this system will allow easy access to the practice. So it will just be a case of simply adding our surgery number to your phone contact list, and you'll be ready to go. So you can text us with any query that you may have. So that be that medical, be that not related to sort of a medical problem. It could be an administrative query. And what will happen is when you initially submit that request, there will be some initial questions asked by a chatbot. And I'll show you sort of what that will look like in the next slide. But this will allow us to triage your query more effectively and more efficiently to ensure that you're offered the correct appointment or advice. And given that the number of queries that we will receive through this and that we currently receive on a day-to-day basis, this will allow us to manage this workload more efficiently and in turn hopefully provide a much a better service. So once those initial questions are asked, every medical query will be reviewed by a GP, a paramedic, or an advanced clinical practitioner, and any non-medical query will be reviewed by one of our non-clinical team. And the aim will be to respond in some way to all queries within 2 hours. So this is roughly how it will look when you first go on. So on the left-hand side, you can see that there's some options that you can choose depending on what your query is related to. And then on the right-hand side, I've just shared a screenshot of what it will look like if you have a medical query. This will probably change slightly, but again, it just allows us to get some focused information from you. It shouldn't be too onerous. And it should only take a couple of minutes for you to fill in, and then that will go through to our clinicians, and they will triage that and provide appropriate advice. So step three, so we will be moving alongside this to a system that we call total triage. So as I mentioned previously, this is what this means is that every medical request will be triaged by a clinician, and we think there's going to be real benefit in that, because what we've done recently, we've done an audit of our appointments over the course of a month, and what we found is that roughly up to about 15 to 20% of appointments with GPs specifically could have been managed by another healthcare professional or managed in another way. So by moving to this system, we hope to free up that chunk of appointments, which will be quite significant. So given that we're moving to this form of contact, which is WhatsApp based, there will be an option. It will be a live chat with the clinician who you're speaking to, which should be very easy to use. You can, if you are at work, you can send a message in. If you're then called away, you can leave the phone and then you can go back to it after an hour or two. So it hopefully fits in with people's busy lives. And the potential outcomes when you do submit a query could be one of a number of things. So it could be a text message from a clinician with advice or treatment. It might be a phone call to get a bit more information, a face-to-face appointment with the most appropriate healthcare professional. So that could in some cases be an advanced clinical practitioner, it could be a physiotherapist, a nurse, um, or it could be signposting to an alternative healthcare provider, such as an external physiotherapy provider or mental health services, etc. Um, we do understand that some people might not be able to use WhatsApp or might not want to, and that's absolutely fine, of course. And reception in that case, if you were to ring through or you were to come in, our reception team can fill in this the WhatsApp for you or show you how to use it. But we would really strongly advise to use the WhatsApp from your phone, because it's much more efficient, and then it allows reception time to deal with other queries. Um, so with any change and with any change in system, there are going to be big challenges, and we're definitely aware of those. I think that the main challenges that we envisage will be the demand versus the capacity that we have as a practice. So um, there will be times that you may contact us, and we do feel that your symptoms require a same day appointment or review, but we don't have the capacity to offer that within our practice. And if that is the case, there will be times that we will direct you to an alternative service, such as urgent care, 111 or A&E. But of course, we will always endeavour to see you and to try and manage your problem as best as we can. Other challenges that I think we will face will be if there's unexpected staff sickness around the time that we change the system. And of course, with any new system, there will always be teething issues and unexpected issues that we haven't planned for. So please do bear with us when we make this move. So in terms of next steps, the aim is to go live with this the changes that I've just discussed on the 3rd of April. I think it would be great to do a follow-up forum about 1 month after to get your feedback on how things have gone and your thoughts. So that's the plan going forward. So that's it. Hopefully I haven't taken too much of your time. Thank you for listening. My colleague Emma's going to put a Survey Monkey in the Q&A. If you do have a couple of minutes to fill that in, we would be really grateful. And Emma's also going to put in the link to our NHS reviews page, because it's always nice to get some positive feedback on the service that we provide. So yeah, that's it from me. I'm going to stop sharing now, but of course if there are questions, we can go through them now.
So one good question was, do our local residents message the existing landline number or a new number?
No, so yeah, good question. So it's just it's the landline. Yeah.
I've got nothing else
Nothing else.
at the moment.
No, that's fine. Emma's put the Emma's put the link. We'll give it a couple of minutes, see if anyone's got any other any questions. I think there's one. I can't. Let me publish that one. So I think there's one here. I contact the surgery on behalf of a relative. Is that still easy? Yeah, it absolutely should be. It should be exactly the same process. So if you're contacting us on behalf of a relative, um, yeah, again, it should hopefully be easier than it is now.
Yeah, we certainly don't want that to be a barrier at all. So we've seen this live in another practice, and that didn't appear to be a problem. So um, we'll certainly be addressing that if it is.
There's one here. Uh, So let's just have a look at this. So accurate cutoff. Sorry, accurate. I think AccuRx cuts off when at capacity. Will the new system do the same? No. So we will be the WhatsApp the platform will be open 8 till 6:30. But as I mentioned previously, there will be times where if your need is urgent and we don't have an appointment on the day for that, then as a triage team and as a hub, we will ensure that we direct you to the most appropriate alternative service. There'll be no, yeah, it won't cut off. How is the data protected? So WhatsApp, as you some people might know, is end-to-end encrypted. So um, your data will be absolutely safe, so that there will be no issues with data protection at all. Is there a patient identifier in the questionnaire that you complete? So when you submit when you submit a query, there's nothing on the actual query that identifies you, but it's linked to your notes on our internal IT system. And then what happens is once that's completed, whatever's been put in the conversation on the WhatsApp just goes into the notes, as is the case with a form that you might fill in on AccuRx currently. Yeah, that's a good one. Don't know. Shall I answer it, Miriam? The question about 7:30.
Yeah, do you mind?
Yeah, yeah, of course. Yeah, no, so that's that really good question. It's something that we are are thinking about. Obviously, at the moment, we open from the accurates from 7:30. Often that it shuts off relatively quickly, which won't be the case with ChatDoc. But yeah, absolutely, that's something that we need to think about because we do appreciate that people start work at 8, so it having it open from earlier on would be of benefit. So yeah, leave that with us if you don't mind, and we'll discuss whether that would be more beneficial to start at 7:30 and maybe yeah
The
for the yeah
discussion earlier was that that's the ambition. We just because it's a new
yeah
system at the very, very beginning,
yeah
um, to maintain a safe service, we want to start at
mm,
8. But I appreciate that. Absolutely very good point. So we'll review
mm,
that.
yeah.
Thank you for
Oh,
the
thank you.
question.
Yeah. Uh, so we'll reset. Let's have a look. So some patients find it reassuring to have a face-to-face meeting with a GP. Will we ever have that choice again, or will it only ever be an option if you decide there is a clinical need? Oh, yeah, absolutely. We'll have that choice again. I think we feel that actually by moving towards this system, um, we will create more capacity for face-to-face appointments with GPs and with the right GP for you, or if there's a specific GP that you would like to see. Um, of course, given the demand that we have, there will be some um, queries or conditions that we feel could be managed with a text message or a phone call to again try and create greater capacity sort of downstream. If you find it reassuring to have a face-to-face meeting with one of the doctors, that's something that we would of course want to accommodate always. I don't know what Mirren thinks.
I've always been
Yeah,
of the opinion if that someone's offered a telephone, people value the telephone appointments and face to face differently. If someone's working,
yeah,
for example, in central London and can't get to the surgery, and
yeah.
their need can be dealt on the telephone, then they find that very convenient. But I totally
Mm,
appreciate that possibly the majority of consultations might need to be face to face, especially initially.
yeah,
And so if someone is offered a telephone appointment, it will be because we feel that it's the most appropriate. But if someone was to reply to say no, they prefer a face to face, we would always want to try and accommodate that. Yeah.
yeah, absolutely. Does
So
that hopefully
if
that
I speak to someone on the telephone and they tell me on the phone that they'd prefer to be seen face to face, and I always try to
mm,
organise that.
yeah, absolutely. Hopefully that answers your question, but if not, please do um, pop something else in the Q&A. Um, will receptionists still be able to help with queries? Absolutely. So within our we're going to have what we call a hub room where we'll have clinical members of staff and non-clinical members of staff. They will be working through or supporting with management of the demand on the day. But what we hope by moving to this system and being able to contact us very easily via WhatsApp is that our reception team at the front of house will have much more capacity to help those that do need, do come into the practice and want to speak to a receptionist or need assistance or who are vulnerable. That's the vision for us. So absolutely, they'll still be able to help with queries. Will all of this info? Yeah, absolutely. So obviously we're going to we'll be recording this webinar and putting it on the website. We'll also publish we'll make a list of the questions and make sure that the answers are accessible. We're also planning on creating a video which will again summarize the changes that we're making, and that will be on the website too. So and there'll be posters and some infographics up in the reception area over the next couple of weeks. So yeah, lots of information. And of course, if you've got any further questions, please always just let us know. Thanks for that positive feedback. Nice. Let's see. Some good questions.
Absolutely.
Yeah, really good questions.
I think we've answered
Yeah,
everything so far.
yeah,
And with that goes without saying, we really value feedback. So
yeah,
that's going to be very important in us adapting to the needs
yeah,
of
absolutely.
of our population and ensuring we can help everyone, um,
Mhm.
even those that um, can't access WhatsApp themselves. But we have the reception team to help them if needed.
Yeah, completely agree. So I'll just have a quick double check. So that's 7:30 on the dot, I think, well, on my clock. Um, so unless there's any other questions, hopefully you've been able to get the survey links, um, and fill those in if possible. That would be fantastic. Um, Yeah, I just want to say, yeah, on behalf of my colleagues here, thanks so much for joining us this evening. And of course, if you do have any further questions after this, don't hesitate to reach out. And if you do speak to friends or family members who are patients, please direct them to the website. And the recording will be on there over the next week or so. Yeah, and thanks so much.
Rick, I'm just thinking if anyone has any other questions,
Yeah,
sometimes we reflect afterwards. What do
yeah.
you think the best way would be for them, for people to contact us?
Um, I was thinking,
I mean, there's an admin function on
yeah,
AQRX, but
yeah.
also in writing, just to the
Yeah, in
practice,
writing. Yeah, yeah,
hand it to reception
yeah.
for the
Just drop
attention
it
of
in.
for the
Yeah,
attention of Dr. Fijten and me
yeah,
myself.
yeah, yeah. That's a really good idea.
Yeah.
Um, yeah, 'cause, yeah. People often think of questions once they've left a webinar. So yeah, definitely. Great. So I think yeah. Have a great rest of your evening.
Thank you for joining. Thank you,
Thank you.
everyone.
Take care.
Take care. Bye.
Bye bye. Do we?